So, the symptoms of vaginal discharge can mean many things. To some degree, some women have a normal baseline of vaginal discharge, and the quantity of vaginal discharge varies from patient to patient. And so, having vaginal discharge in and by itself doesn't necessarily mean there's a problem. However, if you're noticing a significant change to your vaginal discharge, there's more, it has an odor, it is itching, it's burning, you have a clumpy kind of texture to your discharge, it can sometimes mean there's an infection. And so the first thing I recommend to patients is if you're noticing something different, come in and let's do a simple Q-tip culture to really determine what it is. Try not to guess at what you think it is and treat. I do know there are frequently treatment options over the counter for yeast and bacterial infections, but the studies do show that when you go simply off of symptoms and no culture, even for healthcare practitioners, 80% of the time, patients and healthcare practitioners misdiagnose the discharge. And so my rule of thumb for patients, it's always best to come in and quickly just get a simple culture to determine what's going on. Now, if you're found to have an infection, then we'll treat with whatever is required for that treatment. If it's a yeast infection, it's an antifungal medicine. If it's a bacterial infection, then it's an antibiotic. And then, of course, if you've had a new sexual partner or unprotected sex who has had other partners, then I always do recommend that you also get sexually transmitted disease testing and screening because they're pretty prevalent.